Back to our coronavirus coverage happening tomorrow. Governor Gavin Newsom will unveil his plan for the state budget, but he's already announced $2.7 billion in funding for renewed efforts to battle COVID. Reporter Devin Feely breaks down where that money will go.
The governor's plan includes $1.2 billion for expanded testing, signaling a shift in public health strategy away from a nearly singular focus on vaccines as a prescription to end the pandemic.
We've made a terrible mistake. We put all of our eggs in the vaccine basket, and that's speaking from someone who believes in vaccines and the power of vaccines. But you can't really neglect other things.
UCSF infectious disease expert Dr. Peter Cheng-Hung says the governor's $2.7 billion COVID battle plan is multi-layered. $1.2 billion for expanded testing sites and at-home tests, $625 million for testing and vaccination programs in the state's prison system, as well as investments in vaccines, outreach, and additional medical personnel at hospitals statewide.
The money that's being spent in the different spheres seems appropriate right now because about 50% is earmarked for testing. That's kind of where, I think a lot of the anxiety is. And frankly, testing is not only used for diagnosis, but also for prevention.
The governor's budget significantly increases the amount the state is spending to battle the virus. It's up $1 billion, or nearly 60% compared to last year. It's also a clear indication of how dire the situation has become, with cases spiking, testing in short supply, schools shutting down, and hospitals filling up.
I think it is important to prepare and to prepare in multiple modalities, not just all vaccine and boosting,